There is new research beginning to shed some light on the causes, the symptoms, and the potential treatments for long COVID. Doctors say this virus could be staying in some of our body tissues, even reactivating old viruses. Researchers in the medical journal Lancet say at least 65 million people worldwide suffer from long COVID. The symptoms can range from minor itchy skin to a loss of neurological function on the severe end. It is a wide scope that makes it really challenging to study and to understand, and more importantly, to deal with if you're suffering from the symptoms. Joining me now is one of the researchers working to help understand this virus and the ramifications of long COVID. Dr. David Putrino is the Director of Rehabilitation Innovation at Mt Sinai Health System. Appreciate your time this morning, Dr. Putrino. I think when I hear 65 million people are dealing with this, I know people who have loss of smell, loss of taste still from long COVID, the brain fog. What's more concerning is we still don't know a lot of the why, but you're digging into the research. What have you found out?
Yeah, absolutely. Thank you for having me to talk about this. Long COVID is a family of conditions that really take into account anybody who's experiencing persistent symptoms after their acute infection with COVID. And what we're starting to see is that the virus can affect people long-term in a variety of different ways, ranging from completely changing the way that their immune system functions, leading to latent virus reactivation, so old viruses that you thought your body had taken care of reemerge and start causing additional symptoms, ranging from things like what we call dysautonomia, where the part of your body that just automatically controls heart rate and blood pressure and breathing and all sorts of other bodily functions completely gets thrown out of balance and starts causing all sorts of very unpredictable and scary symptoms, all the way through to individuals who had severe acute disease and now have organ damage as a result. So what we're trying to do is understand all the different subtypes of long COVID so that we can begin to trial precision targets for each of those, because a personalized approach is going to be needed in every single case of long COVID.
So it was interesting to read that there is really not a diagnosis for long COVID right now. There's not really a treatment, although when we learn more about it, we'll be able to treat some of these things. But long COVID, at the very least, is now being recognized as a disability. And it was concerning, especially if you're dealing with these symptoms, that there is some ambiguity between the medical community and patients, because you cannot correctly diagnose, that people are skeptical, of what you may be suffering, and can we pinpoint it? Can you clarify some of the challenges in treating people and hearing their symptoms and being able to give them some support in light of the fact that we just don't know a whole lot?
Yeah, I think the first thing that we really need to push back on is the idea that there are diagnostic criteria for long COVID, and they're very specific. They encourage a broader diagnosis because we're still learning, but the CDC very early on and the World Health Organization said to clinicians, listen, anybody who experienced an acute infection, whether or not they have a positive PCR test, if you suspect that they had an acute COVID infection, and now 2 to 3 months later, after that acute incident, they're still having persistent symptoms that weren't there before, or they're having a worsening of existing symptoms that they had because of other comorbidities. That is long COVID. Use that as your guidelines for diagnosing long COVID. The CDC encouraged what we call a clinical diagnosis, meaning that you don't need a blood test, you don't need an MRI scan. You use what the patient in front of you is telling you to diagnose the condition. And this is the CDC telling us what to do.
Right.
So we can be very clear on how to diagnose long COVID.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.